private equity has been quietly reshaping the entire healthcare system so that every patient pays more, gets less, and even if you don't use their facilities, you're still paying a hidden tax. Because remember, the whole goal of private equity is making sure that whatever they purchased and own now is valued more on paper so then they can sell it later for profit. And with that incentive structure, there are three main ways in how the private equity model often introduces pressures that impacts both patients, families, and communities. First off, private equity simply makes healthcare less accessible. If it's not turning a profit, it has to go. So it doesn't matter if it's maternal wards, mental health units, or even trauma centers, it's not uncommon for individual programs or departments or entire hospitals to get shut down. Because sometimes it's cheaper to shut it down than to keep them running. And obviously this has consequences where entire communities could lose access to the only hospital in the area. But it can't all be that bad, right? Surely some patients actually get better care once private equity comes in. Well, this brings us to the second problem. Because best case scenario, private equity doesn't impact quality of care and in some cases expands services and availability. But worse and far more common is they make things worse. A study found that following acquisition, private equity acquired hospitals were associated with significantly worse patient outcomes and even surgery infections. Another study found that nursing homes saw a 10% increase in patient deaths, but you know what they say, what doesn't kill you makes you poorer. Because the third and most obvious impact of private equity ownership is the rising costs of healthcare services. To meet their aggressive return targets and to pay back that debt, private equity owned providers frequently raise prices, increase billing, or boost service volumes. So what this means is that hospital charges rose by 7% and emergency room markups went up by 16% compared to non-private equity owned hospitals. So the point is, more often than not, patients' costs go up while quality of care goes down when, surprise, surprise, you prioritize profits over patients. So the obvious question is, how did we get here? And why is private equity allowed to profit off your sickness? Well, the deeper I looked, the more I realized that healthcare is not broken. It's working exactly as private equity intended.